Students, good morning. This is Dr. Austin Nation. I thought I would take a moment this morning. I'm getting several questions about your community-based nursing project. So I thought I'd send out this short Zoom video. I'm hoping this works. I've never done this before, so I'm hoping this works for you. The first thing I wanted to talk about is I'm getting questions about how many articles do you need for your needs assessment. There's no limit. I don't quantify that number because I want you to be able to put in as many articles as you feel are appropriate to support the need for your project. So for example, if you're talking about a need for a diabetic program among teenagers, you should be able to talk about some numbers, some statistics that support the need for that kind of project. The evidence, this is an evidence-based project. Talk about the need for that kind of project among your given population. You know, minimum, I would expect that you would have at least 3 articles, maybe 5. Remember, this is only a 10 to 15-minute presentation, so you need to sort of, as you're putting together your presentation, keep that time frame in mind. These are time presentations, so I'm really going to be strict on the timing of these because we need to be able to get through all 12 of these. So these are definitely time 10 to 15-minute maximum, and then you will be cut off. So you need to make sure that these presentations are well rehearsed and that you're going to be ready to go. So that is the first question I wanted to address. The other question that I'm getting has to do with understanding how to do your budget template. And I'm going to try to do a share screen. I'm thinking this again should show up on my recording. Again, I've not done this before, so hopefully you're seeing what I'm seeing here. So the first part I'll talk about is volume projection. The question is, how are we supposed to gauge our volume projection? Okay, well, part of that is determining what kind of project you're doing. So for example, if you're doing a project related to, for example, school-based program with kids, you know that there are going to be, so when you're ramping up your program, for example, you would pick a month at random, as again, these are realistic projects, but they're to some degree they're also hypothetical. So you would say, for example, we would be starting our program in the beginning of an academic year, which would be somewhere around August, right? And we know we will ramp our program up with a projection. Say we expect to see X amount of kids when we first start our program in August. September, 10, 20, 30 kids, depending on what your number is, depending on the kind of service you're providing. September, October, we know that in November, December, our volume should go down because of the holidays. You should be able to speak to that, right? We would again then talk about our volume going back up again after the beginning of the year. Again, and then winding again our numbers up as we head into January, February, March, April, May, and then winding down with our numbers in June. And then we would probably say that during the summer months, our program will not be active, or we expect to have minimum activity or whatever it would be. If we're running a program that's year round, you would perhaps you're going to start your program in January, and you would ramp your volume up starting in January, and sort of we would expect that your volume would increase as your program gains popularity and gains momentum, so you could increase your volume steadily throughout months. The group I talked to last night, I was telling them, talking to me about depression, for example, right? Certainly we know, and you would glean from evidence perhaps, that we know that depression certainly has high season, so to speak. Seasonal depression happens particularly high during the holiday season, for example. So you would expect probably some increased volume around that. Again, these are evidence-based products, so hopefully the evidence will guide you in understanding some of this, but you should be able to glean this from your evidence to help you determine what your volume projection should be. So I hope that helps clarify some of the questions that I'm getting around understanding how to calculate a volume projection. So pick a starting point. Be modest with yourself when you're ramping up your kind of program, depending on what it is that you're doing, and sort of who you expect to reach and what's reasonable in terms of an expectation. And again, be reasonable with yourself in terms of, you're not going to get 1,000 people your first month out, right? So that's not even going to be that's not even a reasonable expectation. Moving down into your staffing plan. Staffing plan, productive hours. Again, this is another area. Are you running a business that's a Monday through Friday? And I'm going to actually do these two together because they kind of tie in together as far as planning the budget. Your staffing plan. Who are the people there? Is this a Monday through Friday 9 to 5 business? If so, that's a different kind of business than if you're running a telehealth business, or if you're running a mobile van business. If you're running a mobile van business, for example, are there going to be people that you're going to need to be there consistently to answer phones? Is it a stationary business, right? That you're going to have some base station there, that's someone's there, a receptionist person or a nurse person there all the time to pick up and man the phones, which I would suggest you would do. You don't ever want your business to be closed where no one's there and it goes to a voicemail recording. I wouldn't gather that would be a good way to run any business, right? Who are these people? So you would need some kind of person there that people could pick up, whether it's a phone, or if it's a telehealth, perhaps they're coming in. People will be able to punch into a telehealth resource person that they can get in touch with. Perhaps you have people on call and you're paying people to be on call, and then you're going to pay your providers to be available and paid per visit. You're not paying them by the hour, you're paying them per visit. That may be another option that you discover works best for your kind of business. A mobile van, maybe you're only paying your providers when they go out on certain days for a few hours, Monday, Wednesday, Friday, or so many hours per day, right? Depending on how you're structuring your mobile van to go out to different locations or the same location, depending on what it is you're doing and who you're trying to reach. This is the kind of thinking that you and your group need to think about when trying to set up and structure your particular project. And this is kind of the fun and so the creativity that goes into helping think about who we need to have, right? Do we need a receptionist? Sometimes, now I was telling the group last night, if you're running a service that people are going to need to call in to talk about their medication with someone, having a receptionist there is not the best person, because a receptionist is not going to understand nothing about medication. You need probably to have at least a licensed vocational nurse there to talk about medication at minimum. That would be your minimum skill level required for those kinds of questions. You decide. Nursing assistants are good if it's basic kind of nursing stuff, vital signs. You know what nurse skill, you've all had clinicals at this point in your academic career, that you've got to work with nursing assistants, PCAs. You've seen the kinds of things that they can do versus what your RNs can do, versus what your NPs can do. Versus, you may not have had much exposure to the advanced practice nurse roles, but you can certainly look at those. And certainly I'm hoping that through this assignment, perhaps you're going to be inspired to want to explore some of those in your own academic future. And then again, as you're looking at how you're going to pay those folks and coming out with an annual salary to pay those folks, part of helping calculate that FTE for these individuals, there may need to be some variation on how you're going to be calculating them, right? And you have some examples here, right? Per diems are not an FTE, right? If they're, if you want full-time people available to you full-time, 40 hours a week, right? That's a full-time equivalent, or 36 hours if they're 12-hour shifts. Are you running a 24-hour business where you need someone there day and night? Are they 8-hour shifts? Are they 12-hour shifts, right? If they're 12-hour shifts, you need 2 full-time people for the 3 days, and then another 3 days, and then you need somebody there for that last day to cover the 7-day week. That's day shift, and you need to repeat that pattern for night shift. If you're doing 8 hours, You can, it's a little different formula because you have one day person for 8 hours, one evening person for 8 hours, one night person for 8 hours, and then you need your weekend people to come in, and you can calculate those out as well, the FTEs that you need to cover that. So you need full-time people and part-time people. So again, the variation of the kind of people you need depends on the kind of business that you're running and the kind of project that you're putting together. The other question I got also this morning, and I think that answers that document. The other question I got this morning had to do with coming up with your PEE, which is how you're going to um, be able to develop a plan for, I'm sorry, your quality assurance, not PEE, your quality assurance. You need to have some good 4 high quality measures that are going to be able to actually gauge the success and the quality of the program. And that again depends on the kind of service you're providing. And again, when we're thinking about quality, and you all have now done quality improvement projects in the hospital, you should have an idea of what that concept looks like. That we want to be able to improve our project, or to be able to glean if our project is being successful at doing what our mission and vision says we're setting out to do. Okay, so if we're setting out to be, a resource for patients who are diabetic, then what are the resources that we're providing as the service, and then how are we able to measure that we've been successful in delivering those things to the people that we're saying we're trying to reach? What kinds of tools are we using to evaluate our success in measuring some of those things, right? Certainly one of the measurements is certainly if people are coming back. You can certainly look at your number of visits as certainly an indicator. You can look at your participants' A1Cs. You can certainly look at your satisfaction surveys from people. You can look at information from your providers and what they're gleaning. There's a number of variables that you can be looking at as indicators. And then the last one is the PEE, your personal engagement and empowerment. Develop a target plan to reach your target population. This has to do with more marketing. So again, what are you putting together to reach the people that you say you want to reach? And this again requires a bit of ingenuity and creativity as well. Matter of fact, the whole project, I encourage that. But I really get excited to see what kinds of things you're able to put together. And students have come up with some wonderful things to say, this is how we're going to market to reach our said population, right? Are we going to target with other organizations that are currently existing? Are we going to go to schools and partner with student health centers? Are we going to go to other health organizations? Are we going to put a website out and go on social media? Are we going to, right? There's a million ways that you can target reaching the audience that you're after, right? And so this is, again, your own creativity and ingenuity and what you come up with to reach those folks. And so that is the fun and the beauty of doing these projects. So hopefully I've answered some of your key questions about this. I am available to you over the holidays, so I'm not going anywhere. I'll be around. So hopefully this gets you started. And so I thought I'd put this together as a way to sort of answer some of your immediate questions, because it looks like you guys are now starting to move a little bit on these projects. So I'm excited about that. So happy Thanksgiving, happy holidays, and let me know if you have any questions, okay? Thank you.